Hi, I'm Congressman Mike Fergusin, and it gives me great pleasure to bring you greetings from our nation's capital. Please know that while I'm not able to join you in person for the 2007 National Respite Conference in Huntsville, I'm certainly there with you in spirit today. First, let me take this opportunity to thank you for the tremendous job each and every one of you do, whether you're a respite professional or an advocate or a family member who needs or uses respite. Each and every one of you are making a difference. I would also like to say a special thank you to Jill Kagan, the chair of the National Respite Coalition. Jill has provided unwavering leadership and a deep commitment to improving respite care at every level across this country. Jill, you're a true hero for the job that you've done and continue to do. I also want to thank the Alabama Lifespan Respite Network for hosting this year's conference. And I want to thank Eric Joyce, who's not only a longtime personal friend of mine, but a great advocate for respite care in my home state of New Jersey. And I also want to thank the coalition of over 70 national grassroots advocacy groups who have so proudly and strongly supported our efforts. Lastly, let me thank you from the bottom of my heart for presenting me with this 2007 Distinguished Congressional Leadership Award. It's a true honor for me to accept this award on behalf of the thousands of families who need and use respite all across America. I'm sorry again that I can't be there with you to thank you in person. As you know, last year in a historic move, we were able to get important legislation passed and signed into law that would establish a national respite care program. Over 50 million Americans, including 900,000 in my home state of New Jersey, provide in-home care to their loved ones. Doing so allows these individuals to provide special loving care to family members. While these families choose in-home care over institutionalized settings, many family caregivers say that the stress, from emotional to financial, can be enormous. I saw this firsthand several years ago in my own family when I lost my mother to a long battle against multiple myeloma. Between doctor visits and hospital stays, my dad cared at home round the clock for my mom. By doing so, it allowed him the wonderful opportunity to provide loving care to my mother. But at the same time, it was also very tough and challenging for him. Certainly my dad's story and our family's is not unique. There are scores of families just like ours providing similar selfless acts of kindness in every town across America. But it did give me a first-hand perspective about just how important a brief break is for family caregivers. And that's why I introduced the Lifespan Respite Care Act, because shockingly, our nation lacks a national coordinated approach to help those who need respite care to find it and qualify for it and pay for it. The problem is that respite care is in short supply. Long waiting lists are the norm, and respite care doesn't always exist in some states for children over age 18 with disabilities. The Lifespan Respite Care Act expands and enhances respite services. It would help improve coordination and access for respite care. It would help recruit and train respite care providers and help family caregivers find and pay for respite services. While our important legislation gave the Congress the authority to authorize important funds to establish this program, more work must still be done to ensure that the federal government can pay for this program. Earlier this year, I successfully authored an amendment that would help appropriate $10 million to launch the National Respite Program. While my amendment won House approval, the measure still must receive approval by the United States Senate and ultimately be signed into law by President Bush. Respite care is not a Democratic or a Republican issue. It's an issue important to everyone. And that's why I've continued to work very closely with my good friend Congressman Jim Langevin and Senators Hillary Clinton and John Warner to ensure the $10 million for respite that we secured in the House receives final approval in the Senate. Every day, family caregivers face numerous challenges. They shouldn't have to navigate a maze of federal, state, and local outreach programs to find respite care or worry about how to qualify for it or pay for it. We all know that respite works. Respite improves the health and well-being of caregivers and helps delay or avoid more costly hospitalizations, nursing home placements, foster care, or other out-of-home placements. As I said last December on the House floor, and as you properly titled your conference this year, our successful efforts have been a huge win for family caregivers nationwide, and they send America's caregivers a very clear and important message that help is on the way. Thank you very much for allowing me this opportunity to speak with you, and thank you for presenting me with this very prestigious award.